put something in that baby's mouth. She was crying. Our theme for Doctor on the Line, which means we get to welcome back Dr. Adrian Lord. Good morning, Doc.
Good morning, Colleen. How are you doing?
I am doing well.
Good morning, Barbados.
Good morning.
Good morning, Cassandra.
I was about to say, before we went welcome the doc, we got to say morning.
We've been saying good morning around
the table
for a little while.
This is true. This is true. How are you doing, Cass?
I'm doing good. You guys had a really nice conversation just now about building it. Stories just go on.
They do. They do. And I'm sure that we'll have a continuation of that in another Better Business segment.
Now we're going to talk about building good health.
Yes.
And usually you don't have to go to a quantity surveyor for that, right? You just walk into the doctor. So how is business going these days, Doc?
Business is going good.
I want to ask this question before we get. As a doctor, if you go down to the office and there are no appointments, do you say, oh, what is happening in this country? Or do you say, oh, I feel so good?
No, medicine is not only about seeing patients. Then you have time to do other things. You have time to follow up on appointments. You can make some phone calls and see how persons are doing. You can check on your medical reports that may be outstanding, your bills that you have to pay. So there's always something to do. So we make ourselves busy all the time. We may have home visits. There's always things that happen to do.
You know, there's this perception that people will always be sick, so doctors will always be wealthy.
Wealthy?
No,
are you wealthy, Doc?
We look after the good health of people. We look after the good health, not wealth.
Okay.
Good health of people. Help to build their bodies well. We look at the quantity surveying. We look at the build of bodies. We make sure that they're taking their medication and taking their medication properly. I had a situation recently of a patient who gave up smoking. I really congratulated her. But then she put on weight, and they said, well, that is not unusual because they have this fixation for eating. But she said, no, it wasn't that. She no longer had to walk to the shop to buy the cigarettes anymore. And we must be careful. Again, give up things and then don't find alternatives for them. So we didn't tell her to go and walk to buy rum, but we need to tell her the walk
to the shop,
walk and go and buy the newspaper, you know.
Or just go down to the shop and talk. You know, that used to be the thing. You hang out to the shop.
Yeah, but she kept away from that shop because that was making her
temptation.
Temptation. But she's done well. She's put on her weight, but now, you know, I've advised her what she needs to do now to get her weight down. So it's something that we always need to look at the other side of things. We look at, like, for instance, cholesterol is a big problem in Barbados.
That is not something you want to build up in your body.
No, you don't want to build up cholesterol.
It's not a bad one.
But then persons then worry about the medication and the side effects of the medication, but they never think about the side effects of the effects of the high cholesterol on the heart and the body. Sudden death, atherosclerosis, damage to the arteries, and so on. So you have to look at the balance.
Before we get too deeper into cholesterol, do you think that because of our exposure to North American advertising, where I suppose they have to list all these side effects to sort of get away from legal challenges, that we have now, because I guess we were using these medications before we started getting cable.
Oh yeah, these medications have been around for 30 years. We've been using them, and there have been studies which have shown that they've benefited the population over the years. But yes, because we're now more conscious because of the advertising of these side effects, you wonder, wow, these are worse than the effects.
Sometimes though it sounds that way, don't it? So let's get into this cholesterol thing now. Is there, you know, we talk about stroke and those sort of things, there's an age range where you have to start worrying about that. With cholesterol, is there an age range? Or
yes, you have to start from young. There is evidence from post-mortem specimen that even people who die young, when you do post-mortems, you see all the cholesterol plaques building up in the arteries from as young as in the teens. And we know that our kids love a lot of high cholesterol, the hamburgers, the hot dogs, the potato chips, the fried chickens, and so on. So, and they're not as active because increased physical activities help to burn off some of that cholesterol and that extra fat. If it's not deposited in the arteries, can cause narrowing of the arteries, and then the coronary arteries, which are very small, then become blocked. And that is what leads to a coronary artery disease or a heart attack, stroke, so on.
Doc, I want to pick up on the exercise and weight loss aspect, but before that we need to go to our phone lines. Of course, they are open. You can call us at 228-5562, 228-5563 are the numbers, or you can send us a message on Facebook. I'd like to say good morning to Lloyd. Welcome to the program, Lloyd.
Morning to you all.
Morning.
Good morning.
Barbados. I have a question for the doctor, a simple but precise. My bladder, when I'm of age, 61-year-old, and when I drink a lot of water in the morning, like 2 cups, every 10 minutes or so, I have to pass water. I would like to know if there's a problem there with my bladder.
Yeah, if you're having increased frequency of urination, with or without increased use of water, if you increase your input, then the output will be increased. But if you're having increased frequency of urination, especially if there's an urgency or a reduction in the force of the stream, then it's possible, especially at age 61, that you may have a prostate problem. Your prostate may be enlarged, and usually it is not unusual for the prostate to get naturally enlarged at your age, and you may need to have it assessed. Of course, you need to also have to check for prostate cancer, which doesn't cause those symptoms, and it may be necessary to put you on medication, or at the extreme, you may need surgical intervention for this problem.
Okay.
We hope that's not the case for Lloyd.
Yeah.
Yes.
But certainly it's worth checking out. At
Yes,
least he's
definitely.
paying attention and
Yeah, you need
asking
to
the
have
right
that
questions.
finger test and the blood test as well, and have it checked out, because if the urine stays in the bladder too long, especially at night when they have problems, they can get urinary tract infections, can get prostatic enlargement, which is normal, and then subsequent problems from that.
All right, so let's look at this cholesterol again, because, you know, like you said, it can lead to it can have some serious consequences. Are there signs that you can look at and say, because you don't want to be going along and having calcified arteries? Are there signs?
It's usually very silent until very late. So there are usually no signs that one picks up at all. If it's really narrowed, then the signs of ischemia, which is lack of blood supply to the heart muscles, which can be chest pain, angina type signs, pain on exertion, or if it's affecting the brain, then it could be causing things like dizziness or so on. And these may be just warning signs of decreased blood supply to the particular area.
Okay, we're going to say good morning to Linda. She is on the phone line. Good morning, Linda.
Good morning.
Hi, go ahead with your question.
What I'm trying to find out, I've had a seizure a couple weeks ago.
A severe?
A seizure.
Seizure, okay.
Seizure.
Okay.
And I'm also having a pain on my right side, on my lower right side. I keep going to the gynecologist. He tells me he hasn't seen anything. But then eventually, the last ultrasound I had, he told me he saw a swelling, but he don't know what it is. But I have to go and do an MRI now on my head because I keep getting these headaches as well. So I'm really trying to find out what causes the seizure.
Well, that is what they're trying to find out, if there's a specific cause of the seizure or fit or epilepsy, also known by. If there's a tumor in the brain that may have caused it, or whether it is increased electrical activity in the brain that causes convulsions that you experienced. As for the pain that you're having in the pelvic area, the ultrasound showed a swelling, and your gynecologist is best able to determine if that is of any significance or not. I don't know swelling of what, if it's swelling of the uterus or swelling of the ovaries, but your gynecologist is best suited to do that. If you have seizures or repeated seizures, you need to be on medication to suppress the increased electrical activity of the heart to prevent these seizures, and this medication should be taken on a regular basis. If you're having any effects or side effects, then you need to let your doctor know, so that the medication can be adjusted to prevent the seizures and to make you live a normal life.
Okay.
Thanks for that answer. Quite comprehensive as always. We were talking about cholesterol, and
Yes.
naturally one of the things that comes into lowering your cholesterol level beyond medication is, of course, a healthy lifestyle and exercise. And I was overhearing a conversation at the gym the other day about how many pounds this person is going to get down by Christmas, and they have this dress that they want to get into. And then I subsequently spoke to a doctor who said that's not a realistic projection. Can we pull figures out of the air as to how many pounds we want to lose and then just get rid of them by a certain time? Or are there a number of factors that impinge on if it's a realistic expectation to lose 5 pounds in 5 months or 50 pounds in 5 months?
It's safe.
That's the other thing.
Safe. Yeah, I don't think we should pull figures out of the cap or the hat and say 50 pounds in whatever period of time. I think it needs to be a gradual and sustained thing. There are a lot of weight loss products around that people use which may help them to lose weight, but then when they're off these products, then their lifestyle returns to normal and they put back on the weight. So I don't have a ballpark figure, but 2 pounds a week can easily be lost. I mean, I saw someone lose even more than that in a day. But
healthily and sustained?
That was a boxer who had to get his weight down to compete, and then of course by the time the boxer was able to compete, he was so weak that he lost the fight in one.
Yeah. Exactly.
But yes, but so a lot of our body weight is water, and by losing water they lost weight. But we need to lose some fat, and you need to increase your physical activity, aerobic activity, in order to do that in a sensible, controlled, sustained way.
And it's more about lifestyle change than it is about dieting and exercise, isn't it? Because if you're white-knuckling it through it, the minute you have half a chance for a cheesecake, well, that's it. It's all over.
Yes, it could be.
Once you do the exercise, though, you can rest assured the cholesterol is going to be under control.
That's good. That's true.
Yeah.
Very true.